Policy by my colleague Fiona Singh from the Policy and Public Affairs Department at WCRF International.
Thanks, Jota. So I am presenting how we can translate the science that we've just heard from our two previous speakers into policy action. And just from context, the Policy and Public Affairs Department at World Cancer Research Fund looks primarily at the moment at diet and healthy diets. And we also focus on not just cancer, but all diet-related NCDs. And we look closely at obesity and overweight. So throughout this presentation, I will be talking about that wider context. So, I have no conflicts of interest. So my outline is today I'll be speaking about why we need policy action, firstly discussing obesogenic environments, then looking at the global targets that have been set by the international community. I'll then touch on policy frameworks and looking at an already established framework that we have developed, the Nourishing Framework, followed by introducing, and the main part of the talk, looking at our new policy framework launched today with a third expert report. We're discussing how it was designed, how to use it, and its intended impact. And then I'll be concluding by looking at next steps. So, although well-informed choices are important in influencing personal risks of cancer and other diseases, many factors, such as availability of different foods and the accessibility of physical environments for active ways of life, are outside people's direct personal control. So in order to effect change at a population level, it is therefore critical to consider the environment within which people are making their choices. So the environmental, economic, political, and social factors are important upstream determinants of the behaviours and choices that influence the risk of cancer and other diet-related NCDs. For example, these factors result in food systems that mean the food that is available to people is more processed and often high in sugars, refined starches, and fats, and environments that contribute to sedentary lifestyles. So these factors can also lead to health inequalities, as lower socioeconomic groups are more vulnerable to these affected by these upstream determinants. So therefore we need upstream policy to change these social and economic factors. And it is the government's responsibility to protect the health of their populations in order to create environments for people that are conducive to following our cancer prevention recommendations. So we advocate that public health policies that prioritise laws, regulations and guidelines are critical to preventing cancer and other NCDs. We also think it's critical that a whole of sector, whole of society approach is taken to have concerted effort in policy implementation. We think it should be led by governments, but there are other actors that are involved, including civil society organisations such as ourselves, national and international bodies such as the WHO, philanthropic and other funding organisations such as Bloomberg Philanthropies, and academia is incredibly important. Research is needed to create evidence base to prove the effectiveness of these policies and to help governments to be able to implement policies and convince their politicians and their public that these policies are needed, as well as other actors in the international network. We'll be building on this in a series of reports, as an aside, called the Building Momentum series, which will be looking at implementation challenges faced by governments. We'll be focusing on looking at the different actors and looking at conflicts of interest and how they can be managed with those different actors. And that will be starting to come out in June. Moving on beyond obesogenic environments, we also have global targets that member states have committed to. And here are two examples that relate to NCDs. We have Sustainable Development Goals with a target by 2030 to reduce 1/3 premature mortality from NCDs. We also have the Global Action Plan on the Prevention and Control of NCDs, and that goal is by 2025 to halt the rise in diabetes and obesity and a 25% relative reduction in risk from premature mortality from the 4 main NCDs, which are often diet-related. Progress to date towards these targets has been insufficient, and more action is needed. So we would advocate that a policy framework can support such action. So we think that policy frameworks can conceptualise, organise and package policies, can help plan, develop, implement and evaluate policies, and identify available policy levers and policy options, and then overall creating a comprehensive policy approach. So just to give an explanation of such framework, we have already in existence since 2013, the Nourishing Framework. It is developed as a well-developed example of a policy framework, and some people in the audience are no doubt familiar with the framework and the database that accompanies it. Just to quickly go through it for those who are new to it, essentially it's broken down into 10 policy areas, which you can see here listed from N down to G. And each policy area focuses on a different area of policy action. So for example, nutrition labelling, restricting marketing, using economic tools such as taxes, as an example. They're separated into 3 domains, which you see along the top there: food environment, food system, behaviour change, communications. The idea being that the corresponding actions and policy areas would contribute to increasing the healthy food environment, the food system, and improving the food system and creating behaviour change communication. So one of the strengths of Nourishing is the way that it categorises those numerous policy options to promote healthy diets into 10 overarching policy areas across those 3 domains. We also have an accompanying database that is a useful tool for policymakers, researchers, civil society organisations to check what has been implemented around the world by different governments. And there's now over 450 government policies in the database, and over 100 evaluations of the implemented policies to give further evidence of what is working. So today we introduce our new policy framework. Our cancer recommendations provide guidance for people on how to reduce their risk by modifying their choices. And from a policy perspective, it can be split into these 4 main areas: diet, physical activity, alcohol consumption, and breastfeeding. So in looking at our framework and Nourishing Framework and using it as a foundation, we wanted to expand it to include what the science side of our organisation looks at. And we found that policy levers similar to those to promote healthy diets, which we just saw in the previous slide, can be used to promote physical activity and breastfeeding and reduce alcohol consumption. So broadly, these are measures that can influence the availability, affordability, awareness, and acceptability of healthy diet and active lifestyle. So, as I said, we used Nourishing as the base, and we took and modified it to have 10 policy areas and expanding them to 11. So most of these policy areas on this slide have got similar policy areas from Nourishing. They've been reworded, and we've added an 11th policy area, which is healthy urban design, which is up the top here. So that's a new area for us. And again, all of these policy areas can have policy actions that could affect all of those 4 factors on the right there. So we changed the domain names, as you can see, from food-related domains to healthy enhancing environments, systems change, and behaviour change communication. And we think that when implemented, policy frameworks have the potential to achieve system-wide change, which is what we advocate for. We think that the policy framework should help policymakers, as mentioned earlier, to enable informed policy development and strategic direction, and also civil societies to help monitor what governments are doing, benchmark progress, hold governments to account, and also researchers and academics to identify research gaps and monitor and evaluate the policies that are enacted after this framework is used. So now I'm going to take you through just a few of the different policy areas, so showing you how, looking at specifically how these policy actions could create environments that are conducive to following our cancer recommendations. So firstly, we'll look at creating health and safe settings. We've got some example policy options on the screen, separated into the 4 areas: diet, physical activity, alcohol, and breastfeeding. These are just examples of potential options. I would signpost that in Appendix 2 of both the third expert report and the side policy brief, which I have in my hand, which has also been launched today, we have a comprehensive list of these policy options. So I'm just going to give you a flavour. So for example, in this particular policy area, governments could implement policies, nutrition standards in schools, workplaces and health facilities. Physical activity, implement initiatives that optimise opportunities for physical activity. Restrict alcohol consumption in educational buildings, workplaces and health facilities. And for breastfeeding, implement or expand on the baby-friendly hospital initiative in health systems. For example, Slovenia has a vending machine ban in schools, so no food or drink can be sold in a vending machine in a Slovenian school, alongside other nutrition subsidies and standards. Looking at fiscal policies, obviously a reasonably popular policy option at the moment. So the main two areas that can be broken down into is using economic tools such as taxes and or incentives and benefits. So you can see split here, you have health-related taxes, your sugar-sweetened beverage tax, for example, which obviously have been implemented all around the world at the moment, and our first brief will be reporting on that in June. Or you have an alcohol excise taxes as well, and then you have incentives, so for example, physical activity and breastfeeding. You have benefits or incentives to increase the behaviour, breastfeeding or physical activity. Now looking at marketing restrictions, so this one's quite easy to see how the policy lever can work across these four areas. You can restrict marketing in all four areas. You can restrict the marketing of food and drink, and you can restrict the marketing of sports partnerships and sponsorships of unhealthy products through sports events and physical activity events. You can restrict the marketing or ban alcohol marketing, and there's also now legislation to end inappropriate marketing of baby feeding products. So an example of that from a country that has implemented something in the space of breastfeeding is Botswana. They have a marketing for foods, infants and young children ban across TV, radio, internet marketing, which we've heard of earlier this morning in the session before ours, and it has a very robust monitoring system to check that this has been enforced and if it's been effective. And lastly, just looking at healthy urban design, our new policy area. So this is a really interesting way to see how you can expand nourishing or expand a policy framework, again, to look at all four areas. So you can have planning restrictions on where food outlets are put in different communities. You can have transport planning policies, infrastructure that increases walking, cycling, public transport. You can restrict the density of alcohol outlets so that there is, less vulnerable populations, for example, don't have a proliferation of alcohol outlets. And then breastfeeding, you can implement policies that encourage and support people to breastfeed in public. So an example is Barcelona, where they have an urban mobility plan, and they're trying to implement that at the moment. It has super blocks and other calming measures within the city centre, and it splits up the sort of residential area into these squares or blocks, and this increases the accessibility for walking, bicycling, and urban transport, and increases green space. So the brief I've already mentioned, we have a standalone policy brief. It's available online. I have copies here. We have copies at the World Obesity stand. It will elaborate much more in detail about what I've just spoken about and provide more implemented policies like that of Botswana than I've described in more detail. So I would recommend either finding that online or getting a hard copy today. So to conclude, more action is needed, which is an understatement. So we have currently work at the moment, World Health Assembly taking place in Geneva. My colleagues are there. And we have Dr. Tedros, who is helping to lead the charge on NCDs. And we like this quote because, it's very clear we have solutions, we have ideas, we have policy frameworks, we have policy actions, we have a database of over 140-50 policies. Countries are working, but what we really need is just more implementation of the policy options that we know exist, that we know work, and that we know can make a big difference. So our evidence-based cancer prevention recommendations can help inform policy action to benefit all, And the new policy framework can be used by governments to identify policy actions that, when tailored to their local context and specific needs of their population, which is crucially important, it will help make the environments conducive to following the 2018 cancer prevention recommendations as a whole. Thank you.
Thank you very much, Fiona, for really outlining what has been done, what needs to be done, and it seems a lot needs to be done. So we have time for a couple of questions. Yes, please.
Thank you. Thank you. Kremlin Vikram Singh, WHO Europe. My question is actually to any of the speakers, specifically about the recommendations. One of the recommendations worded as, for mothers, breastfeed your baby if you can. So is it because of the weakness in evidence, or for practical reasons you add this comma, if you can? Or do we not have enough evidence to say breastfeeding would lead to prevent cancers by reducing obesity, or whatever the mechanisms we have looked at? Thank you.
Okay, so that question, I guess, was directed not at Fiona, but at me. Okay, thanks. Thank you for the question. Well, there are certain circumstances which sometimes do not allow a mother to feed her child with breastfeeding, and so the formulation of the recommendation just takes that into account. So if it is possible for the mother physically and mentally to breastfeed her baby, then that is what she should be doing, at least for the first 6 months of life, and then followed up to 2 years with co-feeding, of course, of other foods, then to continue breastfeeding. But it doesn't apply to all women. So the formulation was taking into account that it's possible that certain mothers are not able to breastfeed, and so we didn't want to be too rigorous in the formulation. No.
And I can say
thanks for clarifying.
there has been a lot of discussion at the panel meetings where the wording was kind of discussed, especially because of that point. I think Fiona can join us here at the panel, and we can start the discussion. So we have about 10 minutes for discussion. If you have questions.